I chose to become an FNP because I like kids. I like geriatrics. So with the FNP, you have the opportunity to treat the whole family. So you could treat from newborns to geriatrics. And then also with the FNP, you're very marketable when it comes to job selection. So you could work in college health, you could work in a pediatric office, you could work in a geriatric office. So that's why I decided, let me do the FNP route because I just want to be knowledgeable to treat the whole family. I am Karen Yaboa Normant. I am a family and psychiatric nurse practitioner. I've been a nurse practitioner for over 7 years. So I've worked in a variety of different clinics. I've done home care, I've done primary care, I've done retail clinic. Currently, I'm doing telepsychiatry, seeing patients for mental health conditions. So my advice for new graduate nurse practitioners would be, if you get the opportunity, I would highly recommend you apply for a nurse practitioner residency program. It's very beneficial for the nurse practitioner as they transition from registered nurse to nurse practitioner. So the advantages of a nurse practitioner residency program would include like advanced training of about 6 to 12 months in a variety of specialties. So these specialties include pediatrics, primary care, family medicine, urgent care, dermatology, mental health. The specialty list can vary. You also get mentorship with a nurse practitioner, and you would get weekly class lectures, so you would get up-to-date knowledge on healthcare trends. The disadvantages of applying for a nurse residency program are they're very limited. So what is your advice towards nurse practitioners who do want to work in the emergency room?
So RN experience, like I said, when you're going through nurse practitioner school, get as many hours in the emergency department during your rotations as possible. Network while you're there with the physicians and other APPs. Get your foot in the door if you can. Getting your first nurse practitioner job in the ER is probably the hardest. And then after that, with experience, you'll be able to go wherever, as far as like different departments and hospitals. And then keeping a log of all your procedures that you do is real important, especially when you're a student.
What is your advice for new nurse practitioners?
Definitely don't stop learning. Don't limit yourself. If you're in a field that you're not really excited about, then move on to something else. Sky's the limit. Nowadays, it's, we're getting more autonomous in more states. So really pick something that you really enjoy so that way it doesn't feel like work when you go to work every day.
And what is your advice for future nurse practitioners?
My advice would be don't limit yourself. You may go in thinking you may want to do one thing, but the sky's the limit for nurse practitioners. You can work in cardiology, you can work in GI, you can work in psych, and the sky's the limit. So don't say I'm going in for one thing. There's a lot of different options for us.
What advice would you give to the MP who wants to open his or her own practice?
Advice to the MP, well, expect the unexpected, right? So thinking, all right, if I have a year out that I'm planning something, think 2 years. Or if you had a budget for $50K or $100K or $100,000, that it would be maybe $200,000 that you're kind of laying out. So it's really being flexible, I would say, and just keep your head down and work towards the dream that you're looking to accomplish, because eventually it will happen. You just can't give up. You just have to keep moving.